Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Muhammad Rifki Fadil from class 12 Science 7.
My name is Husnul Afifa and I am from class 12 Science 1.
I am Isabella Zalantina from 12 Science 1.
My name is Anda Afisa Dulestari Kafrawi from class 12 Science 1.
My name is Risha Nur Awalunisa. I'm from grade 12 Science 1.
Indonesia does not use the term lockdown but use the PSBB strategy, large-scale social restriction based on the regulation of the Minister of Health number 9 of 2020. The Minister of Health regulation of course refers to law number 24 of 2007 concerning disaster management, State Gazette of the Republic of Indonesia of 207. Number 66, supplement to the State Gazette of the Republic of Indonesia number 4723 based on the Permenkes number 9 of 2020. The meaning of large-scale social restriction or PSBB are restriction on certain activity of residents in an area suspected of being infected with coronavirus disease. 219. COVID-19 in such a way as to prevent the possible spread of coronavirus disease. 219. COVID-19 so far, the area that has implemented PSBB is Jakarta as the first province to implement the PSBB, followed by West Java province, including Bodebek, Bogor, Depok, and Bekasi. Next, Pekanbaru City, Riau started PSBB since April 17, 2020, followed by Banten, covering the greater Tangerang area, covering Tangerang City, Kabupaten Tangerang, and South Tangerang City have also been running as of April 18, 2020. The province of West Sumatra does not want to be left behind in order to prevent the spread of COVID-19 in their area starting April 18, 2020. For West Sulawesi, namely Makassar City, the PSBB also has been implemented on April 24, 2020.
What is interesting is what is the social impact of the implementation of this PSBB. The central government through the Ministry of Health has firmly issued policies, and the regional government supports the governor's regulation on the implementation of PSBB. Since the enactment of the PSBB, the first social impact of this PSBB is work from home, or the term work from home. However, for some business actors, an exception can be made to operate with restriction on the working human resources and working mechanism, so that the company can still produce its products. So we also know the term work from office, meaning that they still have to work in the office because of community needs such as health facilities and others.
The second social impact is the high price of masks and also hand sanitizer, liquid for washing hands. Even though there is much different price, the original price of a mask for one box of 50 was around 50,000 until 100,000. Now, the price has gone up some and even sell it up to 400,000. As a result, masks are become increasingly scarce. Even if there are different prices from the two products, we can see the impact, namely that people find it difficult to get masks. In addition, multivitamin C is also difficult to obtain. In various modern markets, it is difficult to find vitamin C supplements. Of course, the government is asked to take firm action against hoarders of masks and hand sanitizer through the police. Another social impact is religious activities such as worship that invites many people to temporarily take preventive measures by increasing worship from home. Not a few who speak loudly. Why should worship be prohibited? Maybe that's how loud the voice over this social restriction is. With so many people gathered, we actually don't know whether all of them are in condition not infected with positive or negative COVID-19 status. With restriction, the effort of transmission can be prevented. That is the purpose of the social restriction.
Next is the fourth social impact of the community activities. Namely, if we pay attention and or unconsciously, this has raised our level of awareness as a community to live clean. For example, by diligently washing hands, wearing masks when leaving the house. Of course, this is done to prevent COVID-19. People flock to care for each other regarding the importance of maintaining personal and environmental hygiene. Even before it was banned, the use of disinfectants for the body was also carried out. But the World Health Organization did not recommend the use of disinfectants for the body. However, the vehicle, the environment around disinfection activities is still allowed.
Another fifth impact is the growing level of solidarity among others to help each other. We realize that COVID-19 has claimed not a few lives not only in one country, but also in the world. Many people have died. Our concern for ourselves and others socially has a positive effect. For example, work for medical personnel, doctors and nurses who are on the front line against COVID-19. Some even died, making our empathy and sympathy for our medical personnel grow. Not a few people also sent PPE assistance, masks, medical gloves, and vitamins to them to be able to help those who have tested positive for COVID-19. Not a few government officials, political parties, members of the House of Representatives, provincial DPRD, and Regency or City Council members have to come down to provide their income to help residents avoid the COVID-19 outbreak. Another impact is that the sixth one is a bit unappealing, namely the emergence of residents' rejection of the bodies that died due to COVID-19. This, of course, requires the participation of law enforcement officers to help with this. In fact, the public doesn't need to refuse the bodies to be buried, even though they are positive for COVID-19. Quoted from various sources, that bodies cannot transmit COVID-19. The need for standards for handling the bodies of people with COVID-19 must be carried out with high standards. In fact, we can see that many people are reluctant to help bury the bodies that are positive for COVID-19. They want to be infected, and people who refuse because their territory doesn't want to be infected by the presence of bodies buried in their area.
The social impact of the implementation of large-scale social restrictions as well as is not actually confusing and provoking, but if we look at it honestly, those who reject it actually don't know or are provoked by irresponsible people. In fact, we as a community, if there is a rejection in the surrounding environment, we must give them a good understanding, and it is necessary to intervene by the authorities so that the community can open up their knowledge. There are also many positive social impacts. This is what must be improved. By obeying the rules of central and regional government, we have participated in preventing the spread of COVID-19 so that its spread can be minimized and can break the chain of distribution. This is what needs to be encouraged by the community so that they always make efforts to prevent the spread and transmission of COVID-19. In closing, of course, we hope and pray that the COVID-19 outbreak can soon pass so that we can carry out activities well. Moreover, Muslims in the world should immediately enter the fasting month of Ramadan. May Allah Subhanahu wa Ta'ala give healing to all citizens of the world so that they are free from COVID-19. Of course, don't let worship be interrupted. We as Muslims also want to celebrate the month of fasting happily and on that today. Eid al-Fitr, all of them become winners. May Allah Subhanahu wa Ta'ala have mercy on us all and keep us all away from the COVID-19 outbreak.